In my opinion, the goal of research is to deliver improved patient care and enhance better outcomes. To me, the best kind of research is research that has clinical applicability. Um, I've always thought that the best research is clinical research because it matters. It makes a difference in people's lives. And we've seen that evolve in psychiatry and psychology over my lifetime. We've had tremendous advances in how we've understood the brain and psychiatric disorders. And part of that is the impact of life events on the brain and development of trauma-related disorders and showing how trauma influences comorbidity, but also how to treat it and how to treat eating disorders better and how to treat the kind of uh, conglomeration of psychiatric symptoms that people present with in higher levels of care, as opposed to just focusing on one thing. And that's part of this silo effect problem that I mentioned earlier, that people tend to focus just on one thing. And it used to be you presented to an eating disorder program, you predominantly got treatment for just your eating disorder. And everything else, even though they may have been aware of it, they didn't really actively treat it. For example, they may have identified traumas or not, but they didn't engage in trauma-focused treatments, which we know are important and helpful and necessary for people to get better. People with eating disorders, their eating disorder might get better, but their trauma was unaddressed and they go out and they relapse. And we've shown that people with high rates of trauma and PTSD have had higher numbers of prior admissions to hospitals and to residential treatment centers.